but we thank you all for your patience and joining us today. My name is Dr. Adrienne Yong, and with me is Dr. Sabrina Germain and Sahar Sadougi, who is our research assistant. But you are all here, hopefully, for the right thing. Today, we are very proud to welcome you all for our work in progress symposium on a forthcoming edited collection, tentatively entitled, as we're still in discussion about this, Beyond the Virus, Multidisciplinary and International Perspectives on Inequalities Raised by COVID-19, forthcoming 2022 with Bristol University Press. And so we're very proud to present this today and showcase all of our fantastic 12 contributions, more co-authors than that, but we're going to be presenting and showcasing all of the work over today and tomorrow. And the forthcoming edited collection is going to be part of the Bristol Studies in Law and Social Justice series, which is led by Alan Bogg at Bristol and Virginia Mantovalu at UCL. So just before we start and we give a bit of time for a few more people to join, our very last discussant, Sabrina and I wanted just to speak a little bit about the forthcoming edited collection, to tell you how the idea came about, and to introduce you to its table of contents, and of course, our fantastic presenters today. So the idea really for this edited collection came when Sabrina and I wrote a short reflection on COVID-19's effect on ethnic minority and migrant women and the barriers that they faced accessing healthcare during the pandemic. And this was in the middle of last year. It brought together our research expertise, Sabrina and mine, hers in medical law and bioethics, mine in human rights and immigration law. And after writing this very short reflection, we got quite a lot of attention, including having it cited in the LSE Lancet Commission report on the NHS's response to COVID-19. And from there, we thought this could be something much bigger, but Sabrina and I didn't have the relevant expertise within ourselves to do it. And that is where the idea of showcasing a wider variety of voices through the edited collection was born. So Sabrina and I are fully committed to the diversity and inclusion that we are very proud to represent in this collection. And we really wanted to use the platform of the book to showcase a very wide variety of voices from across the academia, of different backgrounds, genders, you name it. And we are very proud to be able to do so. And as the title suggests in particular, the unique selling point of this book is to draw upon different disciplines, not just related to our own, which is law, and this is obviously hosted by the City Law School, but the multidisciplinary expertise which includes politics, sociology, and of course law, but more importantly also very much from different countries around the world today. So we're very happy to have you all here. The symposium is intended to be a first opportunity for our contributors to meet each other, and of course for us to meet them, as the pandemic has meant that we have all just exchanged many, many emails. But also we would love to exchange ideas with everybody today on this very fast moving and very topical area, and raise awareness of the most important issues relating to inequalities in the pandemic, which I'm sure you guys have heard a lot of over the last year or so. So today, for practical reasons, mainly relating to time zones, the presentations are not in the order that they appear in the book itself, but here they are to give you an overview. So we have split the book into three different themes in the table of contents. The first is this one of power and governance. Today, you will be hearing a lot from the power and governance sections. You'll hear from David Blunt. You'll hear from Roy Gilbar and Nili Karako-Eyal. And you'll hear from the group from the University of Sherbrooke, Marie-Ève Couture-Ménard, Louise Bernier, Mylaine Breton, and Jean-Frédéric Menard, and their fantastic research assistant as well, who has helped out with their presentation. This is the power and governance section. So we talk a lot about the state and control and governing in the context of the pandemic. And then we move on to the more typical inequalities, and these include the gender and sexuality element. So none of these people are speaking today, so we'll come back to it tomorrow, and you'll hear a lot more about it tomorrow if you want to return, and we hope that you do. And the final section that we have is the one on marginalized communities. And today we will be hearing from Natalia Perez de Vasconcelos on Brazil. And tomorrow, more on the other various marginalized communities that have been affected by COVID-19. So that's all from me. I will now hand over to my co-editor, Sabrina, to introduce the speakers.
Thank you very much, Adrienne. I know we're still waiting on a discussant to join us, having technical difficulties signing in, but we'll get started, maybe not in the order that we were expecting, but I should start first and foremost, most importantly, with the housekeeping rules. We will start with the presentations, and each presenter or group of presenters will have 15 minutes. And then we will carry on with the comments from the discussants for about 10 minutes each. And throughout, I will be very strict on keeping time to make sure that the audience has some time as well to answer the questions. So if that works with you, Marie-Ève and Jean-Frédéric, we will start with you. I will now introduce you because it gives me great pleasure to be here today. An unusual setting, or maybe a more usual now setting that we've been doing this for a year. Nonetheless, it's really nice to all see you here. So Marie-Ève Couture-Ménard is a professor at the Faculty of Law at University of Sherbrooke in Canada. She is also a researcher at the Research Center on Regulation and Governance Law. Her research focuses on public health and governance, particularly intersectoral governance in health promotion and state accountability challenges during pandemics. Marie-Ève will be presenting with Jean-Frédéric Ménard, professor at the Faculty of Law at University of Sherbrooke. Upon graduating from McGill, Jean-Frédéric served as a law clerk to the Honorable Justice Louise at the Supreme Court of Canada, and he is completing a PhD in law on the normativity of neonatal critical care at UCL. He's also a member of the Research Center on Regulation and Governance Law and a voice of views on interdisciplinary childhood ethics at McGill. So together with Marie-Ève, Jean-Frédéric will be presenting the contribution they're working on with Professor Louise Bernier and Dr. Mylaine Breton on inequities during the COVID-19 crisis in Quebec, governance law to the rescue, which will also be included, as mentioned by Adrienne, in the section on power and governance of the book. So Marie-Ève and Jean-Frédéric, if you're ready, we are to listen to your fantastic presentation.
All right, thank you very much for the introduction. I'm just going to start sharing my screen. Give me just a second. Sorry. Might sound surprising. It's the first time I share a screen on Zoom because we've been using mostly Teams. And now I need to grant permission, and it's going to take just 1 second. Okay, that should work. Can you see my screen?
We can,
great,
yes, thank you.
Yes, great, thank you. Sorry for the delay. Okay, so I'm Jean-Frédéric Ménard, and I'm going to be presenting with my colleague Marie-Ève Couture-Ménard on behalf of our group of 4. We're very glad to be here today because it's the first time we work together. It's a relatively new topic for us, so we need to emphasize that it truly is a work in progress. but we'll be, of course, very happy to take your questions and hear your observations and comments. So our objective with this chapter we are planning and this presentation today is to explore the impact of law on the worsening or exacerbation of inequities during COVID-19, as well as the mitigating role that law can play with regard to those inequities. Essentially, we started asking ourselves the basic question whether law was part of the problem or part of the solution in relation to the inequities arising out of containment measure in the last year or so. In terms of theory and method, our theoretical framework is governance law theory. Now that may call for some explanation. Briefly, governance law theory is a response to the observation that the last half century has seen the emergence of new forms of regulation, which either undermine or displace law as a dominant paradigm, or call for reimagining it. Governance theory tends to go with the latter option. So it seeks to understand the increased use of new forms of norms, guidelines, recommendations, labels, color codes, nudges, etc. And it looks at these new forms through a renewed notion of legality, which incorporates standards such as reflexivity, inclusion, and consultation of stakeholders. So among the proliferation of norms, the response to the pandemic has generated, and that in itself would be worth investigating, we decided to narrow down our inquiry to containment measures, so what's been called lockdown measures as well. And even among those, to focus on 4 specific case studies. While we plan to cover all 4 in our chapter, today we're going to be presenting 2. The impact of schools closing on young children and food insecurity, and the impact of the imposition of a curfew on 2 vulnerable populations, namely homeless people and victims of domestic violence. So here with this first timeline, we want to give you a very high-level overview of containment measures in Quebec. Some of them will be very familiar to some of you. Of course, every jurisdiction has used a variety or a specific mix of containment measures. In Quebec, the response to the pandemic was characterized by 2 phases. First, there was a very broad containment where most public spaces were closed, such that people did not have much choice than to stay home. Technically, most people were not confined in their homes, but there was nowhere to go as schools, businesses, parks, and so on were closed down. Some populations, such as people over 70 years old, were also strongly encouraged to stay home, while people living in institutions such as nursing homes were not allowed to receive visitors nor to leave the grounds of their homes. At the end of September 2020, a more complex system of alert levels was implemented to track infection levels and modulate measures at a regional rather than province-wide level. So that's to give you a bit of an overview of what's been done. Now, I'm gonna say a few words about the legal framework for the pandemic response. So essentially, most of the response in the province of Quebec was coordinated under the Public Health Act, which confers broad powers to the government when a public health emergency is declared by the government. And this declaration has been renewed essentially from week to week since March 2020. So we're still to this day under the public health emergency declaration. From the point of view of the government, most of the measures that were adopted in response to the pandemic and that we're discussing here have been adopted by executive decree. So either through orders in councils or ministerial orders. This way of governing in a crisis undoubtedly has advantages. It allows for more agility in responding to an ever-evolving and somewhat unpredictable situation. On the other hand, it also excludes traditional democratic checks and balances and concentrates decision-making at the highest level of government. Many of the measures that were adopted, and especially in the first phase, were of broad application, and for this reason, they led to inequities. Thus, in examining the interaction between the measures adopted and social inequities, we formulated the hypothesis that some of the alternative forms of law forming part of the paradigm of governance law were likely to be part of the solution adopted to mitigate the inequities worsened by containment measures. So let's now turn to the first of our two case studies for today. So the first one is school closings, young children, and food insecurity. So basically on March 13th, 2020, schools and early childhood centers, nurseries and preschools were closed by an order in council taking in accordance with Article 123 of the Public Health Act. So very straightforward, school closures applies across the board. But very early on, it was suspected that one of the unforeseen impacts of this containment measure would be its impact on those children who would depend on eating breakfast at school. Because in Quebec, we have this program which provides breakfast to children in school, and therefore attempts to fight food insecurity. Sorry. Indeed, in April 2020, a significant number of people in Quebec, a third of adults living with children, reported living with food insecurity. Across Canada, the pandemic period has seen a 2.5% increase in food insecurity. So very early on, that was a concern. So what we have here is a more specific timeline of the events and the response with regard to this specific situation. What is important to note here is that community organizations were quicker than the government to identify the risk associated with food insecurity, and that they have been an integral part of the mitigation effort in the first phase of the pandemic. Later on, it became a government priority to keep schools open for obvious educational and economic purposes, but also such that they could continue to play their role as social safety nets. So if we start to the left of the slide, on March 30th, we have the school closures. And we can also note that throughout this early period, food insecurity was a concern throughout the society. Some products were scarce, distribution networks had been disturbed. So it was an issue for many people to have access to food. So very rapidly, the Breakfast Club, which is a community organization which is funded by the government, but not exclusively, and that reaches children at risk of food insecurity through schools, they realized that the school closure were very likely to impact their beneficiaries. So first, they alerted public opinion, and they set up an emergency fund to support the population they serve. It took 2 weeks after that for the government to come up with a structured response, and again they mandated the club, the Breakfast Club, to coordinate the logistic of distributing food to those organizations who could reach people at risk of food insecurity at home rather than in school. So this new program, it instead of reaching 30,000 children as they usually did with breakfast in school, it is estimated that they were able to reach 60,000 children and their families through this new way. But the government provided new funding, but they had to rely on the logistics of a community organization to be able to deliver this measure. So eventually, the school year ended in June, and for the beginning of the next school year in August 2020, an already existing measure that was meant to provide food in schools in targeted areas, based on essentially on the socioeconomic level of the postcode. This measure was extended to cover the whole school system in Quebec. So every school was now targeted, and community organizations were also put to contribution, and they were funded and mobilized to assist in delivering that extraordinary measure. In order to support the work of community organizations in delivering the measure and delivering the food aid, they were exempted from closure orders. So initially they were all asked to close down, and they were treated like any non-essential services, even though they were most likely essential. But it took a little while before this adjustment was made, and it was made clear that community organizations were allowed to stay open and to continue on with their mission. And then finally, on the right-hand side of the slide, in December and January, so December 2020, January 2021, we see that the burden of containment measures partially shifts from school to non-essential businesses, because the latter were closed down immediately after Christmas, and the first week of classes was held remotely in an attempt to allow children to go back to school. So the idea was that schools were such an important part of the social network that they had to be protected. So businesses were closed with the objective of salvaging the school year, of allowing students to continue going to school as the third wave was coming. So that in a nutshell is the evolution of the interaction of food insecurity and school closing. So we see that there's been several adjustments that were done from a very broad, very broad measure of school closing everything, and then various actors and new measures had to be implemented to compensate for that rising inequity for a vulnerable population. So now I'm gonna turn to my colleague Marie-Ève, who's gonna present the second case study.
Yeah. Thank you. Hi everyone. So I'm gonna go fast. We have a few minutes left. So the second case study we wanted to talk about is regards the curfew and its impact on housing precarity, on victims of domestic violence and homeless people. So at the beginning of January 21, the government ordered that between 8 p.m. and 5 a.m., no person may be outside the person's residence or its equivalent or its grounds. Note that the fine for violating the curfew was from $1,000 to $6,000. Next slide. Thank you. The curfew was initially implemented for 1 month as a shock measure to stop the second wave of COVID-19, but it was in place for approximately 5 months. Right away, there was concern that it would be difficult for victims of domestic violence to call for help in the presence of the spouse. Also, several emergency housing centers were full before the curfew, while others feared they would run out of rooms. And also, there's a bullet missing, but it's my fault. But know that the homeless people were really under stress, and some had to hide from the police after the curfew, sometimes in dangerous places in the cold temperatures. A homeless man died outside in Montreal, possibly hiding from the police after the curfew time in an outside toilet near a shelter. So right from the beginning of this containment measure, there was a significant mobilization of grassroots organizations and academics that denounced the impact of the curfew on those vulnerable populations. And next slide, Jean-Frédéric. Merci. So here's briefly the timeline, and it's very interesting in this case to compare the mitigation measures targeting victims of domestic violence to those targeting homeless people. So if you look at the red dot,
yeah, but you're gonna have to wrap up soonish.
Yeah. Okay. So what we see. in conclusion, is that the domestic violence victims were automatically a concern for the government, who stated that the curfew should not prevent women from leaving violent household. But it took 3 weeks then for a superior court to decide that the homeless people should be exempted from the curfew. So there were two very different stories in dealing with those vulnerable populations regarding the curfew. One relating really on statements from the government, and the other one mobilizing traditional law and courts to get some mitigation measures officially. Next slide, Jean-Frédéric. Anyway, you'll read about this in the chapter. And in conclusion, so our work in progress preliminary results led us to nuance our hypothesis. So traditional and alternative forms of regulation are intertwined in both generating and mitigating inequities. That's what we've observed so far. And for example, the response to school closings effects on food insecurity combines direct state action and coordination with community actors associated with governance norms. And the response to the curfew's effect on housing precarity combines community mobilization and reactive state action. And so we hope that deepening our research, we will refine our understanding of the role of law in both generating and mitigating inequalities during COVID-19, and maybe identify some patterns or disparities between vulnerable populations that were addressed. So, thank you.
Thank you so much. I apologize for the brief wrapping up, but okay. I think we will have a lot more time to discuss this particular aspect, because I think you touch on a very important point at the end, comparing those two vulnerable groups. So we'll move on to the next presentation, but we'll have more time to discuss this in the question period for sure. So next, we will hear from Natalia Pires de Vasconcelos, and I'm really apologizing. My Portuguese is clearly not on point, Natalia, so feel free to correct my pronunciation here. She is an assistant professor at INSPER São Paulo, Brazil. Natalia is also currently a scholar in residence at the Rusk Center for International Law at the University of Georgia. She researches and writes about social and economic rights in Latin America, with a focus on the right to health and health litigation. Natalia will be presenting her contribution, Business as Usual, Inequality and Health Litigation During the COVID-19 Pandemic for Brazilian Prisoners, which will be included in the section on marginalized community of the book. So Natalia, if you're ready, we're ready for you as well.
Hi, hello, nice to meet you all. Thank you for organizing, and I'm very glad to meet you all in person and not through only emails. I'm gonna jump right into the presentation so we don't waste a lot of time. Let me just share my screen here. I hope you are all able to see. Yeah, so my chapter is called Business as Usual, Inequality and Health Litigation During the COVID-19 Pandemic to Brazilian prisoners. For Brazilian prisoners, and basically my research tries to sustain. Sorry, I'm just trying to put your little heads in a place where I can see the presentation. Okay, so my main argument is the following: health litigation in Brazil. There is a well-established literature that, including Octavio, that is here, that has been for many years discussing that health litigation in Brazil reinforces racial, social, and economic inequalities by the way that it happens in the country. And I'm going to talk a little bit about that furthermore. The COVID-19 pandemic presented an opportunity for courts to be more sensitive to the effects of their decisions on policy and public health. So I'm going to develop a little bit more on that, but basically I'm trying to say that COVID-19 was an external shock that allowed institutions and normal institutional decision-making to be to change, to address contingencies and possibly set a new standard for how the right to health and health law is dealt with in Brazil. This has been, however, a largely missed opportunity for courts. They have addressed health litigation in Brazil as business as usual. And I'm going to present to you what I mean about business as usual. In one side, you have the general public's health litigation as a right to everything, and that's something that has been a big concern for this health litigation literature, which is basically a right to health litigation that is concentrated in richer neighborhoods, richer cities, richer states that have less vulnerabilities in terms of healthcare and social and economic services, social economic status. And these are mostly the people that are bringing claims to the court system. And the court system has this general standard for a right, the right to health, meaning a right to everything. That this is a claim by Octavio. And for those that are incarcerated during the pandemic, but even before, the right to health is basically a right to nothing. So claiming that you have a right to health that would allow you to finish your sentence at house arrest or to early release is something that courts before and during the pandemic have not taken. The right to health that is involved in those claims have not been taken seriously. So how this argument goes. First, I think a little bit of context. Brazil has a constitutional right to health. It's a very extensive constitutional article. I just brought to you a little bit of an extract version of this right, a short version of this right. But our right to health directly states that the state has a duty to protect the right to health of all, and that should be done through social and economic policies. And this actually is done by social and economic policies. We have a universal healthcare system that is free and provides universal healthcare coverage. It is one of the largest, if not the largest, in terms of number, healthcare systems in the world. And free, completely accessible, anyone can use it. It provides pharmaceutical assistance, all sorts of services. And it deals with the challenges of being a universal healthcare system in a middle-income country and highly unequal country as well. So this is kind of the institutional background that that where health litigation happens. What do I mean by health litigation in Brazil? So over the past probably 20, almost 30 years since the Constitution and the creation of our universal healthcare system, we have an increasing average now of roughly 100,000 cases filed every year against the public healthcare system. These lawsuits are normally filed by individuals. They are not collective claims, they're not class actions, they are individual cases, and they require medicines and services. The evidence that we have of who are these plaintiffs, who are these individuals, shows that they come normally from the least vulnerable neighborhoods and from richer cities and richer states. And vulnerability here means also vulnerability in terms of access to health. So they are promoting these cases, they are filing these lawsuits from areas where there is a lot of healthcare coverage, there is a lot of healthcare provision. Not to say that the healthcare is not flawed or doesn't need to be corrected or improved, but this is kind of the profile of who is filing those lawsuits. So it's not the bottom of our social and economic division in our population. As you all probably know, Brazil is a very unequal country, is one of the most unequal countries in the world. So you're looking at a middle income, upper middle class or upper middle class that is using the court system to, and sometimes lower middle class too. And there is variation across the country. This is something that we've been studying more and more. But what the evidence that we have is that this litigation is coming from the places where there is less vulnerabilities in terms of healthcare and other welfare services. A lot of these claims, at least half of these claims, are asking for drugs, treatments that sometimes are completely out of policy for fair reasons. The universal healthcare, the policy has decided that these treatments should not be provided because they're not cost effective. Either they're extremely expensive or they are unsafe. But the average of success for these cases within the court system is very high. So from between 60 to 70% of these cases are decided in favor of plaintiffs. In some court systems, this percentage goes way up to 80 to 90%. So pretty much it is very, very likely that if you have a legal claim for a treatment or service, and the only reason that sustains normally your claim is the constitutional right to health and the doctor's prescription. If you present those two before a judge, that court is gonna grant you the treatment that you want, regardless of any other healthcare claim coming from policy officials. So it is very unbiased, it's very biased towards plaintiffs and litigants, which in one side you can think this is good because it makes the right to health mean a lot. But at the other end, the right to health is not only about what courts can do, but it's mostly about what policies can provide. And this makes policy officials and the policy pretty much very hard to be managed and has to deal with litigation at this level. Judicial decisions are followed by or guaranteed by the threat of very strong sanctions, and it's very often fines or the blocking or seizure of public budget. So there is judges actually blocking public budget accounts and transferring those resources to treatments directly, to plaintiffs directly, or even the detention of policy officials. And this, as you would imagine, causes an increasing expenditure on compliance with those decisions. Between 1% to 8% of state budgets are now destined to address litigation. At the federal level, it's around 1%. And all the hidden costs that are not only connected to provision of these medicines, but also to the organizational costs of creating a new staff, new administrative branches to deal with compliance and defense and making litigation smoothly. So it becomes like a second institutionalized door to the healthcare system that does not has the effect of making these treatments or drugs collective. I should say that in Brazil, the idea of a precedent, a legal precedent, is very weak. We've been improving that for quite some time, but basically you have a one claim, one treatment, and that treatment is hardly made collective to the entire population. So it makes managing the system through litigation very problematic. So this is kind of the tendency of a rise. I've collected data from 2016 to 2020. This is just at the trial judge level, like the very brand new cases. And you can see that like the tendencies, it even increased during the pandemic. We'd have to see now what happened at 2021. And this data has some issues, and that this doesn't include criminal cases. It's just about like people using administrative law and the constitutional right to health to ask for drugs and services. Okay, so hold that thought and let's look at mass incarceration in Brazil. Brazil has the third largest prison population in the world. And these numbers haven't been updated since June 2020. So you can have, through this information, you can have a sense of how our prison policy works. We have data is really bad. It's a very opaque policy, and that's kind of the way that the policy it's internalized into the policy that you don't provide information to human rights organizations, to the public, to families, to lawyers and public defenders. So it's a very difficult, very closed system in terms of access to information. Over 50% of this prison population is young, very young. And out of the 88% of this prison population that has declared their race or ethnicity, 67% of them self-declares black or pardo. Pardo, I think it's the closest translation is brown. It's not exactly the same, but just to give you something that is close. And so what this means is that there is an overrepresentation among the prison population of very vulnerable communities, which are in Brazil as well, because we are very unequal racially as well, the Black and Pardo communities. 30% of this population is under pre-trial detention. They have not been sentenced. So they are living in overcrowded conditions at a level of 151% of occupancy rate. So basically, so in some states, prison facilities put twice as much people as they can hold. So it's a very problematic system in all ways. And I'm going to talk to you a little bit about what happens at the healthcare level. You would imagine that if the rates of overcrowding are this ones, you can imagine that health is not a priority for this system. Close to 42% of the prison units do not have medical facilities, not even a single space where prisoners can be treated. And this gets worse if you're looking for specific spaces like a vaccination room or a snitching and bandaging room, or access to x-ray rooms, waiting rooms, areas for decontamination for personnel or material, dressing rooms or bathrooms is specifically destined to healthcare workers. So whoever works in the prison facility is under extreme, it's under dangerous conditions, risky conditions, and at the same time, you can see that health is not a priority for the prison administration as a whole. Most units don't have a single doctor or nurse present every day. So assistants, nurse assistants, as we call it in Brazil, are the main and probably the only access to a healthcare professional for people in prisons. And the rate of doctor per capita is absurd. It's like one doctor for every 870 people. So it's basically no doctor, right? Like you're not going to see a doctor unless there is one present at that day, which is not going to happen. Which is something that is not going to happen. Cells are often windowless. Prisoners take turns. Sometimes the overcrowding is such that people have to take turns into who sleeps, who stands. And in some units, there's lack of clean water, power, sanitation. Food is something, food insecurity is another issue. Families are sometimes the main source of food for prisoners. So one of the things that happened during the pandemic is that blocking access to families made food insecurity skyrocket. We don't have measures, but we have reports from human rights organizations listening and talking to families and people in prisons right now. And well, and as you can imagine, many communicable diseases, they run free. As an example, the levels of TB and HIV are much higher inside in prison facilities than outside. And of course, violence is part of a daily life, of the daily life of prisoners, violence from other inmates, and also violence from prison staff and police. So it's like a generalized absence of any human right protection. Well, what happened during the pandemic in Brazil? So we have now over 16 million cases confirmed, and this number is rising. As you can see, there is close to 500,000 deaths, also rising the number every day now. We are, I think, getting to a third wave. So it's all tragedy in this presentation. I'm so sorry. And well, a systematic failure from the government to address the pandemic. To some, it has been inertia and inefficiency. To others, they are like some academics and public intellectuals are more courageous and are openly calling this genocidal politics. And you can see our president here, Bolsonaro, with the way that he uses his mask. I think it's symbolic to how he's been addressing the pandemic. And the picture below is the Manaus crisis at the Amazon, where we had like a generalized lack of oxygen for people. So people were dying out of air on the lines with COVID. So you can see people like bringing these oxygen tanks from one place to the other, trying to make healthcare provision happen somehow.
I'm going to ask you to conclude if you can rapidly.
Okay, I will. So I'm going to be very quick, and then I can address some questions during the questions phase. But basically, the pandemic hit very hard Pardo and Black populations. This was very problematic during within the prison system. So the data is really bad. But what we know is that families were not able to access the prison population. They had no news for months and months, and even defense lawyers were not able to access the prison population and know what was happening right there. Riots and violence were skyrocketing, and a rise in reports of torture and violence. So what happened with litigation? And I'm going to be very brief. So basically, health litigation remained the same before and during COVID pandemic, before and during the COVID pandemic. So judges pretty much took this as business as usual. The time that they took to actually decide cases was, they were deciding cases even faster, but the levels of granting petitions for the general public in terms of the right to health remained pretty much statistically the same. So they did not change the pattern that they were addressing health law cases. And they weren't even concerned with COVID. So COVID was not present in judicial decisions at all. So you can read a case that was decided during the pandemic. You're not going to find judges talking about the healthcare crisis that we are living, but they are dealing with health law and right to health cases. So this is insane. At the same time, health litigation for prisoners also remained the same. So we had like a skyrocketing number of habeas petitions filed from prisoners trying to get out of the prison system, to be transferred to other units or to be transferred to house arrest or early release. And almost 90% of those petitions were denied, even for people that were part of risk groups. And those 9% that were granted, if you read them, they were going to be granted anyway, regardless of COVID. So it's judges are absolutely non-sensitive to COVID within the prison system, the risks of COVID to the prison system.
Thank you.
And
I'm sorry, I have to stop you. I'm
yeah,
really sorry.
I'm sorry. No, I'm going to end this, but like I can go back to this during the questions phase. It's just that this line is very dramatic, and I wanted to end it with that, or how judges think of that. But well, that's it.
Thank you very much. And for sure, we will come back to this in the question period because there's so much to be discussed in this. Thank you so much. Great presentation. So we will now move on to the presentation from Roy Gilbar, professor at the Netanya Academy College in Israel. His research interests include medical law, bioethics, tort law, and socio-legal aspect of health. Roy is presenting with Nili Karakoiyal, a senior lecturer in Haim Strick School of Law, the College of Management, also in Israel. Her research has appeared in peer-edited journals and law reviews. She's also the director of a patients' rights clinic, which addresses issues of distribution of health resources, the right to medical care, accessibility to health services, patients' right, public health, and accountability of health providers. So together, Roy and Nili will be presenting their contribution, authority and governance in Israel during the COVID-19 pandemic, a crumbling of solidarity and the rise of social inequalities, which will also be included in the power and government section of the book. So Roy and Nili, the floor is yours. I will be keeping time again.
Thank you, Sabrina, and thank you to Adrienne for the book and for this project, which I think is really brilliant. So let me take you to the presentation itself. Just a sec. So Nili and I would like to present before you some findings that we kind of re-examine the relationship between law and solidarity, and particularly we went through how COVID and the legal measures to fight COVID. How legislators view this policy in terms of protecting public health and preserving human rights on one hand, and the issue of solidarity on the other. So these are the main aims of our paper, of our chapter. So we ask, or we want to examine how did the law in Israel contribute to the fight against COVID, and we stopped when vaccination started. So just a quick kind of a demographic background about Israel. So Israeli population is about 9 million people, and you can divide the population to three main segments, which are very important from our perspective, from the perspective of managing the pandemic. So you have ultra-Orthodox Jews. It's a very close-knit community, and you see the numbers. And the biggest minority in Israel is the Arabs. They're mainly Muslims, and accounts for 20% of the population. And the rest is secular and religious Jewish people, and more than 2/3 of the population. So some background about the coronavirus in Israel. So you can see the first case was confirmed or diagnosed in February 2020. We had 3 lockdowns. Between March and April was the first one, then in September and October 2020. and the last one was between end of December to beginning of February. And you can see that the vaccination project started on December 2020. Now we have nearly 2/3 of the population got the vaccine. So government is, we are pretty much free out of, so back to normal pre-corona, like in a few days now. You can see the numbers of confirmed cases from the beginning to a few days ago, and you can see the number of deaths from COVID. So what did the government did in terms of the measures that put in place? So I don't think that they are different in other countries, but nevertheless. So we have isolation of patients, confirmed cases, and of people who were in close contact with them. And for people who returned from abroad, we had prohibition on gathering. You can see 20 people outdoors and 10 people indoors, and only for family members, no friends, no other people indoors. And government shut down all educational institutions, including primary and secondary schools and universities. We still kind of teach via Zoom, although schools got back to normal a few weeks ago. The government decided that most people would work from home. Staff on site were limited to up to 30% of the workforce. Obviously, government shut down all private and public providers of goods and services, including shopping centers, banks, theaters, all activities roughly when we were in lockdown. A legal duty to wear face mask and keep physical distance were also put in place. And the policy was to also impose lockdown on long-term care homes, just to protect the elderly and those with severe disabilities. So how did the government enforce these measures? I think part of the measures were quite extreme in the eyes of kind of liberal or people who believe in democratic regimes, but nevertheless. So the government allow the police to give fines for violation of the regulation, for people who did not wear face masks in public, and for people who operate their businesses during lockdowns. They also allow the police to enter into private properties to enforce the regulations. The government also established an organization or a public body that conduct epidemiological investigations. So nurses or other people kind of called patients who were diagnosed with COVID and asked about their whereabouts for the last 14 days, just to track other people that were in contact with them. And I think the most severe or extreme measures was to allow the Israeli Security Authority, which is roughly like the FBI or the MI5, if you like, to trace patients' whereabouts using their cell phones. And you can imagine that the last measure was was not accepted positively by the public. About the legal process, how these measures were kind of put in place. So in Israel, we kind of got an inheritance from the British mandate. Before the establishment of Israel, the British mandate was here in the land of Israel, and they gave us the opportunity, or they gave the government, the Israeli government, to issue regulations without the approval of parliament. So these are called the regulations for time of emergency. They are valid only for 3 months. And after that, you either kind of approve them, the government approve them for the beginning, from start, or they kind of being abolished. Nevertheless, these regulations must comply with two main acts, which are considered part of the unwritten constitution of Israel. These are the basic law, human dignity and liberty, which secures human rights, basic human rights, like the right to autonomy, equality, and others, and the basic law of freedom of occupation. Nevertheless, Parliament still has some discretion or some authority to consider, the measures that the government put in place and the policy that being chosen. So when we went to see the discussions in Parliament, we saw obviously the tension between, on the one hand, to promote or protect public health, and on the other, to protect or preserve human rights. And when Parliament discussed these two aims or issues, solidarity, you can see at least some of the legislators talk about solidarity. So this kind of trigger our thought that we must kind of go in deep and see how it went in the discussion. So just a quick word about solidarity. It is a contested principle like autonomy and others. So we adopted Pransek and Buicks. I hope I pronounce her name correctly. So they see solidarity as a practice, not just as a sentiment, as a practice that expresses the willingness to support and assist others. People that have similarity in a relevant respect. And the relevant respect, as you can see, is determined by the specific situation. So the time of a pandemic, when people have a same cause that they want to fight, the same risk or enemy, so to speak, give kind of the notion that people might act in a solidaric way. And Pransek talk about three different levels of solidarity. One is interpersonal between two or specific people. Then once it is kind of become more shared so people in a group adopt this notion of these practices of solidarity. It gives a sense of community to this group. And Pransek said that it is the heart of the idea of solidarity. Then the next level or the highest level is the society level, when solidarity or when solidaric practices become a legal norm, and this is again the highest level of solidarity. So what Nili would do now is to show you some extracts from Parliament and talk you through about the issue of, from the one hand, about protecting and promoting public health and human rights on the other. Nili.
Thank you, Rui. Just checking I'm on the right one. Okay, then a word about the research itself. I practically reviewed all Parliament protocols starting at February and ending at the end of August. And the idea was to try and identify recurring considerations. And we identified 4 themes, of which I will present only 3. The paper will present all the 4, but for this purpose, I will address only 3 of them. And the first one is promoting and protecting public health. That's, for example, during a discussion that addressed the question of whether the Israeli Security Authority should be authorized to trace cellular phones, one of the participants said, "We are in a situation where we have returned to the numbers of about 400 patients a day. This is a number we last saw in late March or mid-March. The pandemic continues to spread in the world. As of now, there are 10 million confirmed patients, 500,000 died. There are 150,000 new patients a day. We lost the control we had over the course of the pandemic, and we had control over it. We rose from 0.3% confirmed patients of all tests to 3% of confirmed patients. This is a significant leap, considering that we face multiplication of the number of confirmed patients every few days. We need to use all the tools at our disposal. The second theme that we identified is protecting and preserving human rights. Review of the discussion suggests that the participants addressed two issues. The first one was whether the suggested measure infringed individual rights and to what extent. Thus, for example, during a discussion that addressed the issue of enforcement, one of the participants said, "In the name of the coronavirus pandemic, everything seems to be allowed. And that's something unthinkable, really unthinkable. This matter of entering private properties without an order, without suspicion, cannot be agreed. But I do say that the Ministry of Justice must understand that human rights can be ignored every time the situation is a bit complex. We said we will live with the coronavirus. We must also live with human rights. These rights can be revoked because it is a bit complex. I will not support a vote aimed to prevent gathering and allow the police to enter private properties to do whatever we want them." The second issue in this theme was the constitutionality of the infringement. Thus, for example, during a discussion addressing the issue of technologically supervised isolation of a person entering Israel, one of the participants asked another one, "Aren't you afraid that the High Court of Justice will repeal the act?" And the other one answers, "Look, I don't know what will happen in the High Court. But if the High Court uses its common sense and asks, if I don't have the act, what is the alternative that currently exists in the hands of the government? The alternative it has is a more severe violation of human rights. And the idea in this act is that the right to choose is given to the individual." The third theme.
I'm sorry, Nida, I'm going to have to ask you to wrap up soonish, please.
Okay, the third theme, really. Okay, the third theme concerned the issues of law, solidarity, and personal responsibility. For example, there were three subcategories, okay? The first one is the importance of the law. For example, one of the participants said during one of the discussions, "Why do we need this tool?" And I would say, especially when we are getting back to routine. First and foremost, citizens' awareness of the existence of a special situation is declining. Awareness of precautionary measures and the willingness to follow them decreases. The willingness to give up comfort in daily life, such as isolation or so, decreases. The second subcategory refers to the law's limited role, or why the law is not enough. And one of the participants said, "We also support the idea that the public should be committed to this mission, because at the end of the day, the public have the tools to maintain social distance and stop the spreading of the pandemic, which are no less than ours. And I want us to say it every time without fear, the public must be a partner in this challenge of ours." And finally, the third subcategory is the role of the law in special communities, for example, Orthodox, Jewish, and Arab communities. Thus, for example, one of the participants said, "The second axis we have been running since the beginning is the halachic rabbinical axis. The chief rabbi of the police, station commanders, and other officers all the time conduct a dialogue with rabbinical leaders out of understanding that without rabbinic ruling and rabbinic statement, we will not be able to convey the messages." Way back to you.
Okay, can you go? Okay, final slide, but can you go to the next one, Lily? Can you go to the next one?
Okay.
Okay, no, it's okay. I'll do it.
Very, very quickly, Roy, please.
Yeah.
Thank you.
Okay, that's it.
Okay, just a sec. Okay, some analysis. So what we found out, maybe it's quite obvious, but still, we found that it is impossible to fight a pandemic only with solidarity, particularly in Israel, which is very much divided between groups, and we do need the law. But when you use the law, you actually compromise human rights. So in a sense, we see that solidarity does protect human rights, because when people act in a solidaric way, you don't need legal measures to enforce and compromise human rights. But on the other hand, it is impossible to fight a pandemic only with legal measures. You do need solidarity, but the problem is that, at least in Israel, the tier 2 solidarity, the group solidarity, because we have 3 different communities and the level of solidarity within each is quite high, they are not so much committed within the society on the whole. So to convince each group to act in a solidaric way, you need to go, as Lily presented, you need to go to their leaders and convince them that it would kind of promote the common good, and not just of their people, but on the whole, for kind of for the promotion of public health of their, and for the promotion of personal health of each one of them.
Thank you.
So that's it. Okay.
Thank you so much. Thank you very much. And I feel horrendous cutting off everybody with such interesting presentations, but that will make for richer discussions in a few minutes. But now, last but really not least, we have David Blood, lecturer in international politics at City University of London. Prior to City, David was a Louvier Early Career Fellow at the University of Cambridge. His recent monograph, Global Poverty, Injustice and Resistance, was published by Cambridge University Press. So he will be presenting his contribution on lockdowns and liberty, and that will also be included in the section on power and governments of the book. So David, we're excited to hear about your presentation.
Great, thank you very much, Sabrina. I will try to keep within the bounds of time as much as I can. So the title of my talk and the chapter is Lockdowns and Liberty, but I assure you that I will get to equality as well, because for me, the two concepts are deeply interrelated. So what sorry, that's the wrong slide. Where I started thinking about this issue of the regulations brought in with COVID-19 and the idea of liberty was around this objection that was around political discourse in the United Kingdom, but also in the United States, also in Canada, also in pretty much every major democracy has a very small but quite vocal minority dissenting from the regulations brought in by government, normally around ideas of freedom and liberty. Now, this tends to get dismissed as being crankery, right? Mainly because it runs with a whole bunch of ludicrous conspiracy theories about Bill Gates wanting to use 5G to turn us into automatons or some such. But I don't think it's actually prima facie absurd, right? The expansion of state power into areas of our lives where it didn't exist as directly as it does now in reaction to the coronavirus pandemic does seem to be a reasonable concern. So this libertarian objection might be plausible as just keeping bad company. So one of the things I want to do in this chapter is to look at this, honestly, give it a fair shake, then probably show that it's kind of an absurd objection, mainly because it's not particularly relevant, but then reconstruct it using an alternative concept of liberty. So what do we mean when we talk about liberty? Unfortunately, I've sort of been looking over the literature that's developing around COVID-19, and people tend to have a very uncritical idea about what freedom or liberty means. I'm using the two as synonyms, as you may see. Typically, what we see both in protesters in the streets and their sympathizers in academia and the press, we get a Hobbesian idea of liberty, or the idea that liberty is non-interference. This is a very simple and very sort of widespread way of understanding liberty. It simply means that when you are not obstructed from doing something that you both want and are able to do, you are free, right? So if you're not prevented by the law from acting in a certain manner, then you are freer than you otherwise would be. It's a coherent conception of liberty. And we can see that in the case of COVID-19 regulations, there has been a contraction of liberty. I don't think this would be a particularly controversial statement, but let's unpack it a little bit using mask mandates. Prior to the pandemic, I was able to get on the London Underground without wearing a face mask. Now I could choose to wear a face mask if I wanted, but I wasn't mandated to it. With pandemic regulations, I now can't do that, at least without the risk of incurring a fine. My space of freedom has been contracted as a result. My can-do assumptions about how I can conduct my daily life have been limited. Now, my problem with this isn't with its coherence. It makes sense to me. My problem is with its irrelevance. I'm not sure why I should care, particularly about why there is this increased regulation of my personal choices, because we accept this sort of interference regularly in the pre-pandemic times, much more stringently. So for example, I'm sure everyone is happy about this, but I could never get on the tube naked, right? This was not considered to be a particularly egregious violation of my liberty. Indeed, I never felt that as a limitation on my liberty at all. So what makes these mask mandates any more important is the question, or many more significant? And I found by looking over the objections to the mask mandate, a very limited amount of objections that get raised. So oftentimes there are appeals to individual autonomy and perhaps human rights, rights discourse around freedom of expression. Unfortunately, this doesn't tend to be developed as well as I would like to see it, right? So for example, freedom of expression is often associated with mask mandates. I walk around Southwark and I see sort of graffiti sort of stuck onto lampposts saying, resist the muzzle or take off the muzzle. If you looked at Twitter this morning in the UK, take off your mask was a trending hashtag, but it's unclear how this limits my ability to express myself because, of course, I can express my objections to wearing a mask quite easily. People do it all the time. They post it online on Twitter. They have organized rallies objecting to lockdown measures. They have representatives in Parliament arguing for the easing of restrictions. So it's not clear how autonomy is, or how freedom of expression is being limited. At least the case hasn't been developed with sufficient sophistication. The other line of attack that people say, or people address, come from people like Jonathan Sumption, formerly of the Supreme Court of the United Kingdom. He's objected both to sort of the limitations, but his more interesting work is on the processes by which these regulations have come into play, which he says are quite irregular. The problem is he's not able to make this case. He is clearly Hobbesian in his conception of liberty, and not to get too deep into the weeds of the history of political thought, Hobbes generated his conception of liberty with the key idea of reconciling liberty and autocracy. So if there is sort of a benevolent dictator who doesn't interfere with you, Hobbes says you're free. Now, other conceptions of freedom might object, but if you're not being interfered with, you're free. So Sumption's procedural objection doesn't make sense based on the way in which he conceptualizes liberty. So it basically leads to this sort of so what moment with the libertarian objection, where it's not clear why freedom trumps the public health benefits generated by these regulations. So this is a way of, sort of diffusing this objection. Now I'm going to reconstruct it, because liberty is not the exclusive property of libertarians or Hobbesians. Indeed, as someone who identifies as a person of the left, I find it extremely irritating that the right wing has taken over the concept of liberty as its province. I think it is ridiculous. My preference for thinking about liberty comes from the Republican tradition. And by Republican, I'm not talking about Donald Trump. I'm talking about a longer tradition of intellectual history. This is a negative conception of liberty, to use Isaiah Berlin's terms, but it doesn't understand liberty as the absence of interference simpliciter. It is the absence of arbitrary interference. And this makes a lot of difference. And the paradigmatic case is slavery, right? A slave can have a benevolent owner or a lazy owner who never interferes with their choices. they're not subjected to interference. Now, it would be very strange to say that this slave would be free. A Hobbesian would be committed to this. A Republican would not be, because despite the fact that they are not interfered with, they are always vulnerable to interference. And that vulnerability is what contracts liberty. Now, this appeals to me for a number of reasons. It captures some of our, or I should say my, intuitions about liberty. The first is that there is a qualitative difference between a law made in a liberal democracy characterized by the rule of law with democratic accountability and the fiat of a dictator. The two things seem intuitively very distinct. And this is a way of reconciling law and liberty together in a way that doesn't recourse to metaphysics or thick conceptions of the good. It simply says that laws, when they are adequately controlled, when they are adequately regulated, are not an impediment to liberty, because liberty is not just the can-do assumptions that we have in society. When we're talking about political liberty, we're talking about our status in society, that status of citizen or that status of free person, which is what we see in the history of Republican thought. The Hobbesian understanding of liberty loses sight of this important status element. And Quentin Skinner has done a lot of good work on this, if you're interested in the history of this, obviously. So let's relate this back to COVID-19. So the first conclusion that we can have, and I'm going to be wrapping this up, hopefully I'm not running too late. All right, thumbs up. Relating this back to COVID-19, we can say that there is no primary reason to think that COVID-19 restrictions limit liberty, at least not in the context of a liberal democracy characterized by the rule of law with parliamentary oversight, with free and fair elections. That's a whole lot of caveats. I fully admit that, but it means that we can't simply come out and say the government has increased legislation and in doing so has decreased our liberty. That is simply not on the table. What is on the table is using this conception of liberty to look at how specific COVID regulations have come into play. And I'm going to look at 4 instances in the United Kingdom that give me cause for deep concern about both liberty and equality. So the first is Boris Johnson. And I'm not going to engage in character assassination here, but I think that the Prime Minister's character is in fact genuinely relevant. I don't think I will be going out on a limb to say that Boris Johnson has a tenuous relationship with the truth and the constitutional guardrails that exist to keep his office contained, which are highly customary in the United Kingdom. It exposes his personality. If you paid any attention to Dominic Cummings's testimony, if you've been listening to sort of insider reports about how Boris Johnson runs his government, he loves the concentration of power in the executive. He tries to get away from Parliament as much as possible, going so far as to illegally prorogue Parliament prior to the COVID crisis and the debates over Brexit. Boris Johnson, I mean, this might be hyperbole, but he seems to be a political leader most attuned to personalized rule since Charles I. And it's no coincidence that Charles I was a supporter, well, was supported by Thomas Hobbes and was the bête noire, the man of blood, for Republicans during the Civil War period. The fact that Johnson is unwilling to maintain the sort of customary constraints on the office of Prime Minister shows how pathetic these constraints actually are to constraining executive power. Now, setting aside Boris Johnson, who I clearly love, let's look at the COVID-19 regulations that were brought into place and how they were brought into place. Now, the first thing is the Coronavirus Act. It's a really interesting act. I would focus on one really important element of it, and that is the spending powers, which are unprecedented in many ways. It basically gives the executive the ability to spend at will without parliamentary oversight. And not to go back to the Civil War again, this was one of the major causes of the rift between Crown and Parliament back in the 17th century. The ability to spend without representation was seen as being a key characteristic of a lack of liberty or an absence of liberty. And it is only really due to a backbench rebellion in league with the opposition that a very mild 6-month review process was brought in for coronavirus. But as we can see amongst the spending scandals relating to the NHS test and trace system, relating today to how Michael Gove gave funds to a firm that he is very matey with, in terms of a great deal of public mismanagement of funds, we can see this being a deliberate attempt by the government to avoid parliamentary scrutiny. Now, one of the things that I find fascinating is that when it came to the actual lockdowns, the restriction, the closing of public venues, the closing of private businesses, restrictions in the way in which people go about their daily lives in the United Kingdom, it wasn't the Coronavirus Act that the government chose to implement. Neither was it the Civil Contingencies Act, which would be probably the next appropriate form of legislation to draw upon. It was the Public Health Act of 1984, which is an incredibly obscure bit of legislation to rely on. But indeed, this is how the lockdown was framed in this country. Why is the question. The Public Health Act was designed to constrain individual cases where a transmissible disease would be detected. So if someone came back into the United Kingdom carrying drug-resistant tuberculosis, for example, they would be appropriately subjected to Public Health Act. If they came in sort of healthily without coronavirus, it seems an odd choice. So why choose it? The simple answer is accountability. With the Civil Contingencies Act and the Coronavirus Act, there is a wide degree of parliamentary accountability and scrutiny. This does not exist for the Public Health Act. Indeed, if the Public Health Act was designed to do what's been done in the country, it would have had much more stringent parliamentary oversight required. Why did they choose it? To avoid attention, to avoid scrutiny, and to avoid accountability. I think you might be seeing a pattern of how the British government has dealt with coronavirus. The final thing that I'll talk about is the way in which the regulations have been enforced. And we only have sort of preliminary evidence on this account, but it has given the police a wide degree of discretion in the enforcing of these laws, which may be affecting minority communities far more greatly than the white majority in the United Kingdom along racial lines and possibly along class lines too. It has also given the police the ability to levy extraordinary fines, fines going up into the thousands of pounds, fines which would have been outside of the scope of a judge in a civil court to give. Delivering this power to the police does not make sense. Indeed, the police have been cautioned by their own representative agency early in the pandemic that the government was saying that they had powers they in fact did not have, and that they should not be going around policing the regulations because in fact they were not embedded in the law. But we can see in this a trend, right, that we should be concerned about, because unlike the libertarian objection, the Republican objection can ring the alarm bells. This is causing a drift, at least sort of, I think there's an argument to be made, it's causing a drift towards personalized government, which is not accountable. It is facilitating corruption in public spending. And more fundamentally, it is eroding our status as equal citizens by subjecting us to arbitrary power. And it will be no surprise that the more vulnerable in society are going to be more subjected to arbitrary interference by the authorities. And my concern, if we go back to the title of the collected volume, Beyond the Virus, is that there will be a legacy of this beyond the virus. That Britons are going to become more accustomed to the arbitrary interference of their state. And this is not a call for small government. It's not a call for sort of a libertarian American NRA style government. It is about accountability. It is about our ability to use our power as citizens who are equal before the law to check excesses of power. And this government is proving remarkably adept at avoiding that sort of accountability. And I'm done.
Thank you so much, David. I was about to be infringing on your liberty and be arbitrarily stopping the presentation. Thank you very much. That was excellent, just like all the others' presentations. So we'll move to the portion of the presentation that will invite the discussant to give us some feedback on all those presentations. And I will ask you to more or less keep to time as well, around 10 minutes. And if I may, I will ask Marie-Andrée Jacob to be commenting on the first text. Let me introduce her first. She's a professor at the University of Leeds. She previously worked at Keele University and at Université du Québec à Montréal. Her sociolegal work is interdisciplinary, drawing on ethnography and more recently archival methods. studies. She's generally interested in activities that sit on the border between legality and illegality. Professor Jacob is the author of Matching Organs with Donors, Legality and Kinship in Transplant, and the co-editor of a research handbook of sociolegal studies of health and medicine. So thank you very much, Marie-Andrée, and the floor is yours to make your comments. Thank you.
Thank you, Sabrina. Thank you, Adrienne and Sarah. So quickly, I have two papers to react to in a short time. So first, the paper Couture-Ménard and the authors, thank you so much for this. I really like the careful timeline. I thought it really gives you room for a detailed analysis. That was great. And I think your case studies, the two that you presented, I'm sure the two others as well, are really, for me at least, it was pressing some elements of governance theory that I think your case study refines and enriches some theoretical concern in governance theory. So I'd like to press a few of these points, if I may. So Jean-Frédéric, at the beginning, you were talking about those, this governance theory and multiple norms, and talking about the negotiation between state and non-state actors. And you were talking about activists and grassroots later on also in the presentation, and also Marie-Ève. So I thought there was a third player there, and they are there in the presentation, but perhaps in the chapter you could tell us more about this, expertise. The literature on governance theories sometimes very critical of rules by experts, but they have been really present in the last year and a half, and their expertise now is very rarely unquestioned. Now they are at the beginning following the science, but now they are very questioned, and it has expertise has also acquired some negative connotations. So here I thought in your case study, the mitigations are sometimes, it seems like, led by some experts. In your presentation, you said that there were some academics involved in in initiatives led by communities to alleviate the impact of curfews, for example. So knowing this, I wonder then, what can your paper tell us? What do we mean by community? What do we mean by grassroots, and who speaks on behalf of local grassroots communities? And I thought in this sense, Marie-Ève, at the end, it was really interesting because you had briefly time to draw this comparison between the different reactions, the victims of domestic violence and the homeless people. So there was a different, it took more time to react and it was less organized. So this comparison, I think, gives us potentially can give us information as who speaks and who lobbies for those different groups. So it might be that women's group really have better connections with government, and I know there is the literature of governance feminism, which tells us about how different groups have the ear of the state much faster, and so perhaps organized differently, better organized. So we see that there was, through this comparison, and if you add the Breakfast Club to this, then we see there was some kind of the state is reactive in different way, reacts differently to different stakeholders, and those who speak on behalf of those stakeholders. From what I understood, I thought the Breakfast Club was a kind of a success stories, but then when we talk about the women's refuge and the homeless situation, it was, so what's the hierarchy here, and is there a hierarchies of suffering? It's interesting that it's children and women who are the successful stories. So who is the state more readily aware of and ready to listen, and who are those communities who speak on behalf of them? Also, what happens to the state when we talk about a reactive state, an agile state? So what happens when the state is reactive? It's expanding. So then perhaps your paper can also teach us a lot about a state under pandemic conditions. Some people have compared pandemic condition to war conditions. Then what happened to the state? And perhaps a last comment. The paper is really nice and retrospective, looking back at the time, and I said it at the beginning, I like that. So I wonder if in the chapter you can anticipate and imagine that kind of grassroots state expert interactions for the time of recovery. Not when it's quick reaction, we need to organize quickly. So on a different timeline or temporality, how do you imagine a slow recovery from the damages of the pandemic? So thank you so much for the paper. So just some questions, and I can't wait to read the full paper. And thank you also to Roy and Nili for the paper. Very rich data. I really like that approach of driven by examining in detail the particular terms, language used in the debate. So thank you for that. So briefly, a few quick reactions. Apologies for there being bullet points. Actually, your paper, when I read the abstract and I was listening, it reminded me a bit of Nancy Fraser, of this dilemma between the politics of recognition and the politics of redistribution. Given that, and I know you too have an interest in distributive justice, and you have both written about it in terms of access to ventilator during the pandemic. And so, but also I think this issue of recognition and redistribution, given that Israel is a very complex society, that's a self-understanding that really can bolster sometimes and boosts the collective identity of certain groups and perhaps undercutting others. So I thought perhaps this Nancy Fraser's take on this can be something to think about in the paper or not. Also, yeah, following from this, the distribution here, distributive justice in Israel is complicated because of some ethno-racial religious relations and hierarchies in Israel. And I documented this in my previous work, but you are much more updated on this than I am. And also there is, I was thinking also as being a chapter of a book, there's another contributor in the collection, Marie-Andrée Sirleaf's work, so who writes about racial valuation of disease. So priorities and so solidarity and redistribution are not just blanket term, you know, they are differentiated. And I thought perhaps the cross engagement with the chapter by Sirleaf might be really interesting in your chapter. So finishing also, I want to say a few things about solidarity. So it was nice to see Barbara Prinsack in Brick's work. It's really great work on solidarity. But I was wondering if I could press some little, what happens if we would have a differentiated the complex concept of solidarity or solidarities? I think what, for example, happens to solidarities if we take the similarity element out of it, or if we expand what a similarity is. I think that's in the relevant aspect. I understand that's part of the, but what do we mean by similar? I think the pandemic really showed that our similarity with viruses, with nature, with animals, with living beings. So this identity-based notion of solidarity, especially in the tier 2, I think is really up for grabs, it seems, under the current condition. And yeah, so so just as an element, as a way of provocation, what would or if we get rid of the similarity, what kind of and actually I will end with a provocation from solidarity. How about if we would use the gift as a, because I think the gift, as you know, as a the Marcel Mauss give us this total social package, not necessarily relying on similarly. Perhaps, the most complex is in the tax system, where you don't know. It's a reciprocity, and there's always a risk. And most relationships of care start with that gift that, reciprocity is there, but it might not be. So this risky to have solidarity with people that you might not affiliate or connect with. And again, I do say this knowing how complex and fragmented Israeli society is. But and I thought also to finish, I was thinking, I read this book recently by Sarah Gwilym called Fighting for Dignity. It's migrants' lives at Israel's margin. And it talks about another group that perhaps doesn't have that tier 2 solidarity as intact as the other group, is a lot of migrants worker in Israel who are not Palestinian citizens, who are not Jewish, who are coming, sometimes they stay for us, sometimes, but this is also quite an important part of the Israeli society and economy. So those migrant workers, West Africans, Filipinos, what does tier 2 solidarity mean? So who is left out of this tier system of solidarity, and can we actually think through that concept? But I will stop there too. A very rich paper. Thank you so much for the invitation, and I can't wait to read both chapters. Thank you.
Marie-Andrée, fantastic comments. We're all so excited that you're here as well to provide us with such wonderful insights. So I'll invite Marie-Ève and Jean-Frédéric, and of course all the team of co-authors to make some brief kind of responses to these comments. And then after that, Roy and Nili can also comment and respond. Thank you.
Okay. Okay, maybe I could start with thank you for the observation about the role of experts. That's something we had on our mind already, and it's so interesting the way experts have been involved. On the national news, you would generally have like the same doctor every day presenting just before the press conference where the Prime Minister and the Director of Public Health would make their new announcements. So you'd have, on the one hand, you would have the official experts would be reinforcing the message of the government. Then we saw dissenting experts who started to present another narrative, trying to challenge the sort of the official expertise of the official epidemiology. So that's very important. And I think there's probably a fourth player that we could also add it's the media, because the media have been very involved. They gave platforms to all these experts. And what's also interesting is that there's been a bit of a short circuit of the usual academic network processes, in the sense that people would, instead of taking a long time to write a critical paper, publish it in a law review or in a scientific journal, they would send it directly to the newspaper as an op-ed. And then that is what would get the discussion going. So also the role of academics, the role of experts has been sort of changed by the pressure of time. So there's definitely all sorts of very, very interesting insight in what you suggested. Marie-Ève, do you want to? I know Marie-Ève, yeah, go ahead.
On the expert answer, I think I can just agree with Jean-Frédéric, and it was on our mind too. And I think the only thing I would add is that it seemed interesting to us to differentiate experts within the government structure and experts outside the government structure. And I think the pandemic really showcased some uncertainties in the roles of experts within the government, like the kind of equivalent of chief medical officer. Its role is not that clear, even in the Public Health Act. Under an emergency, he took a place very important compared to what it could have been otherwise. If like, let's say the Prime Minister didn't want him to be in the media that much, it could have been that way too. So there was a very discretionary part also from the Prime Minister in the sense of the importance that he gave to this expert in the media, for example. So rich subject too. And I think I would answer about the community. So I think you're right. This is something we have to reflect on, like who just know a little bit more about who are the actors, who are behind the mobilization exactly. And I think it's good to know that the court decision regarding homeless people, the lawsuit was initiated by a legal clinic whose mission is to promote access to justice for the homeless. So it was really like a kind of community-based movement that led to this lawsuit. And it was really shocking to see that so many voices were telling the government that it was not a good idea to apply the curfew to the homeless. And then one of them died and everything changed. But I think the story here will be interesting to have in more details also when compare it with it. So anyway, I think your comments are just all very good, and we'll try to integrate them. And yeah, so we're going in the same sense as you.
Maybe if I can just add something about for me, merci. And it made me really reflect on how, who gets the money and who gets the attention of the government for us. Esther, our research assistant, brought it up yesterday, and we were like, oh yeah, so there was a delay between the two reactions. So for me, it's a key point that we need to really reflect on and find the answers, because the Breakfast Club has been having a very direct link with the government. And a few days after, they really changed the budget. They were very, very efficient, and just they still got the money, but they had the power to use it differently, and they were still at the focus, or they were still leading the initiative. So the fact that everyone was telling the government for the homeless people that it was a problem, but it took the lawsuit to get really clear answers. It's certainly something we need to reflect on. Merci beaucoup. C'est vraiment un bon point.
Thank you. Marie-Andrée, can I ask you to briefly respond and comment?
Yes, so thank you so much for the comments. You're absolutely right, and it seems to me that you are quite familiar with the Israeli society, which is quite good. As Nili said, we identified 4 themes, and one of them, which we didn't have the time, obviously, to present before you, is a theme about distributive justice and social inequalities. Throughout the public discussion, throughout the last year and a half, there is an intense public debate in the media and within the legal community about social inequalities, about distributive justice, and it was reflected in Parliament as well. But we will address this theme in the paper itself. About solidarity, I think the problem, at least what we saw in Israel, was that as the pandemic kind of went on and people went into lockdowns time and time again, you can see that people lost trust in government. And there were quite a few politicians who violated, even the president of Israel violated the kind of the legal measures that put in place, and other politicians as well. I'm sure it's kind of, you can maybe in your own country you can see that as well, and this kind of people lost trust in the government, and I think the sense of solidarity, as we said in our paper, you can see a crumbling of solidarity in Israeli society because of that, because people lost the trust, and we intend to highlight this aspect in the paper. So this is the response, I think, to your comment about similarity, because as we went, and the first lockdown, people had one enemy, and we're all in this together, and all these kind of nice slogans, etc. But as kind of we went on, we saw that people didn't see risk or didn't perceive risk similarly. So people in high risk, they were eager to do whatever just to protect their health, whereas young and healthy people perceive the risk differently, and they were quite eager to open their businesses, even to tolerate the fines that the police kind of imposed on them. So I think, yeah, we intend to highlight this aspect that you rose, but again, we had only 15 minutes to talk about it.
So I keep on cutting you off. I'm so sorry. Neely, do you want to briefly say something? And yes, I'm sorry, I just want to make sure we give time to everybody to.
I want to address Marie's comment about solidarity. The question whether we need similarity is a great one, because what happens if we put it aside and look for something else? And looking into immigrants, they were considered to be one of 3 communities which the government gave special attention. There was the Haredi community, Arabic, and immigrants. Each of them was attached specific officer to take care of this sector. And while the immigrants are not homogenic community as the Haredi or Arabic, they are still living in the same area, sharing the same style of life. There are sub-communities in the bigger community of immigrants, but they do have similarities. And even if they don't have such similarities, we can look into other common things, such as the value of health, stopping the spread of the pandemic. And there is another thing. All 3 communities were under discrimination, and they experienced negative feelings from the entire public. So they were all under attack, each one in its own unique way. So maybe this is the kind of thing that it separates, but it also creates solidarity within the sub-communities, but not with the total public. So it is very interesting because we find solidarity in different levels, and at times it contradicts each other. So we will try to address this issue as well in the paper.
Thank you so much. Thank you all, very interesting thoughts. Now we'll move on to the second discussant, Octavio Ferraz. He's the co-director of the Transnational Law Institute and reader in Transnational Law at King's College London. He is the author of Health as a Human Right and the Politics of Judicialization of Health in Brazil, published with Cambridge University Press. So I cannot thank you enough, also Octavio, for accepting to comment on the papers. So the floor is yours.
Thank you very much. It's a pleasure for me to be here. Sabrina, Adrienne, thanks for inviting me. And it's a special pleasure to comment on Natalia's paper, which I've only heard now. So forgive me if my comments are not as well structured as they should be, but we've been collaborating for a long time. So I can't say that I'm completely in the dark here. I kind of knew, like, more or less what kind of angle she was going to take, and I have to say I like the angle. I think that the initial question is very good, like, and the way it's framed, that there was an opportunity there for Brazilian courts to maybe show a more sensitive side, but they haven't, at least according to Natalia's initial findings. So it was a missed opportunity, business as usual. So I'm afraid that the Brazilian courts never let us down when it comes to, like, adopting a progressive stance on any issue. So why would it be different with the incarcerated people who as some of the data that Natalia has mentioned there already shows how these people are treated by the Brazilian legal system. Just the sheer number of individuals being held in custody under pre-trial detention, it's a scandal. 30% of the prisoners, it's been like the object of reports by the Inter-American Court of Human Rights for decades. And that doesn't sensitize the Brazilian judges who keep like putting people in jail and keeping them there without any final condemnation. So unfortunately, it's not surprising, but I think it's important to highlight it again anyway. And I think that the way Natalia proposes to do this is really interesting. I like the idea of the right to nothing, not only because it then gives like a nice counterpoint to my idea of the right to everything for the middle classes, but I think that it's a good opposition to highlight. So just a couple of things like to suggest. You mentioned that there is 10% of habeas corpus petitions which are granted. So 90% are denied, 9% are granted, and I don't remember what the rest 1% was. But I wondered whether you could try and compare these two to see whether there is any pattern that explains them. You mentioned in passing that the 9% which are granted have nothing to do with COVID. So I wondered whether, like we do in the normal judicialization, you could find some interesting correlations between success and failure and some characteristics of the claimants or their circumstances, like race, for instance, which is one of the topics that you highlight there, or socioeconomic status. I only know of one granted habeas corpus, which was highly reported in the media, which was of the friend of the president who got caught and imprisoned for corruption. And then very quickly, he got an habeas corpus to go out. And that was based on COVID. So it was the risk of his age and his comorbidities. So why did that work for him and not for like so many other thousands of, maybe you have something interesting there to explore. The other thing of your data, I think maybe you could not improve, because maybe you're already thinking about that, but add is like the number of doctors for the prisons. You said 804 for 700,000 people incarcerated. Could you convert that into doctors per 1,000 or 10,000? So then you can compare with the WHO recommendations and also with the number of doctors across Brazil, and also try and map out the regional inequalities. As you mentioned there, Brazil is one of the most unequal countries, and the regional inequalities are quite stark. So I think it would be interesting for you to map out those inequalities also within the prison system. So are the doctors, do they vary from Sao Paulo to the Amazon in Manaus as well within the prison system as they do outside? And then compare the same with the number of deaths. You mentioned 215 deaths in prisons in total, but if you disaggregate that and then show, like, is there also like some interesting differences between prisons in the South and in the Northeast? Does that map align with the other inequalities that we know or not? Like, so I think there's so many interesting things you can do with the data you have in terms of disaggregation and then comparison within prisons and outside prisons to try and highlight your right to everything, right to nothing dichotomy. So that's basically it. One last comment, the 60% rate of success you've shown there seemed to me quite low. So I would be interested in knowing what your data set is, like where did you took like that rate from, even to update my book, because I say that they are between 80 and 100, and now you're saying 60s on average. So I would like to be corrected if I missed like some important data that you have unearthed now with your study. Now, I had comments for everyone as well, but I know we are running out of time. So thank you very much for your really interesting presentations, and congratulations again, Sabrina and Adrienne, for such a great initiative. It's going to be a great book, which I look forward to seeing in print.
Thank you so much, Octavio, and thank you for your support. We really appreciate you all taking the time to be here. We might get back to you to make some comments on David's presentation, however. But Natalia, if you want to respond briefly, comment, and give those statistics some meaning, apparently it's very important now.
Thank you, Octavio, for your comments. You're absolutely on point. I think I can play with the numbers a little bit more. There is, as you know, data on COVID in prisons is very bad. So we know that it's underreported, like everywhere else is underreported outside of the prison system too. But within the prison population, we suspect that it doesn't match the health conditions and the way that other diseases with a similar pattern of spread normally spread within the prison system and how they are reporting COVID. So we don't really know. Many people within the field of criminal law have been challenging the data. So these 200 deaths, most likely many more that are just underreported or happening within the prison facility and being reported as something else. And there are other kinds of deaths that are connected to COVID, and because of the conditions that COVID puts prisons on, as isolation, lack of food, lack of hygiene items, and everything that comes with access from the families. So definitely these numbers I can play with them, but I still don't trust them. So one of the big things that we are trying to expand is like, how can we look into how these numbers have been are being made. So we know that São Paulo has one of the best numbers, but they still it's really bad. In other states, it's much, much worse in terms of who reports what and how. Just to give you an example, the federal panel that shows information on prison on people in prisons that have been infected or died of COVID. Some states haven't updated the numbers since December last year. I've been following up, and like they just are not updated regularly, and you don't have daily data, so you don't even know how to like the rate of spread within the prison facility within prison facilities. So it's really messy. But I get your point, and I'm definitely going to do that with the data for health structure and health provision, the ones that we have. And comparing the habeas petitions that have been granted. So we looked into those, and they are not only not connected to COVID, but we couldn't find something that is particularly attached to the person that is filing that habeas petition. We haven't looked at the person's profile, because a lot of those cases they run in like the filing. You cannot access the filing because they're in judicial secret, as we say. But I'm going to look into that because this case, the president's friend case, is quite an interesting take. It was actually not in São Paulo, but still, it really showed how the judicial system selects who is going to grant rights and who is not, who's going to grant rights to and who's not going to receive them. And I think about the 60%, this is the number that we are finding right now at the city of São Paulo. So we are looking at health litigation 2019, 2020, and looking only at cases that involve the city of São Paulo. And we found that the average is a little bit lower, but it might not be the average for the state, like the state as a whole, or the other countries or other states, sorry. So I'm definitely going to double check that, but I don't think your numbers are inaccurate. I think they're quite accurate, but like at the state level, because we know that like when you get out of the city of São Paulo that has more specialized courts, more or less the Fazenda Pública courts, things go just down the road. So I don't think that you should be worried about your numbers currently. And that's it. And thank you so much.
Thank you so much, Natalia. I'm sorry to cut everybody off. Octavio, you just mentioned that you had some comments on David's presentation. Unfortunately, our third commentator couldn't be there to comment and discuss because of technical difficulties, but Richard Ashcroft, David, will send you definitely some comments on the blog that you've published and some questions on this very interesting topic. Octavio or Marie-Andrée, if you have any comments at this stage, they would be more than welcome. Otherwise, we can turn to some questions for David as well.
Should I go? I actually said I had comments for all the presentations, but David's is the one I actually agree most with. So I won't have any like really critical comments. I totally agree that the libertarian conception of freedom, which I think in the debate some people would call factual freedom, is something more akin to license rather than freedom. So if you have that distinction that some people do between factual freedom and normative freedom is what is interesting, right? It's what you can do. So it reminded me of Orwell's Down and Out in Paris and London. There is a passage when one of the characters is in a pub and starts like a fight, completely drunk, and says something like, oh, if not for those laws that robbed me of my freedom, I would have killed like that guy, you know? That's not freedom, right? Freedom to kill someone you don't like. So I think that assumptions, arguments, and all these other libertarians, you are right, like it's not like even plausible, but it doesn't throw away, you are right, like the interesting issue. So what is the limit of these public health measures before they start interfering with freedoms? And we are doing a project comparing 60 different countries, the Lex Atlas, COVID-19. And one of the things we are looking at is cases that went to courts claiming that lockdown measures actually did infringe on freedom disproportionately. So I think that what you say, arbitrary freedom, we could also use the test of proportionality. If it's disproportionate, it's arbitrary, and that's the kind of lockdown public health measures that do impact unjustifiably on freedom. But then obviously the difficult issue is to determine. People will reasonably disagree about what kinds of lockdowns are acceptable or not. I think some lockdowns we saw around the world, like Wuhan, for instance, wouldn't be acceptable anywhere in the Western democracies that adopt a Republican conception of freedom and liberty. But the French and the Italian ones, were they justified or not? Like, I think there are interesting debates to be had there. And I think your chapter will be great to establish that framework. How do you look at those issues outside that implausible and not very helpful idea that any public health measure is an infringement of our freedom, only in that very narrow and uninteresting and helpful sense of freedom as license. So that's it.
Thank you very much. Marie-Andrée, do you want to offer some comments briefly? No?
Okay, there's very little time. You can open for questions.
Sure. Oh, David, would you like to respond and comments?
Yeah, I mean, thanks, Octavio. That's really interesting. I think I'm glad that that you agree. I think there is this really interesting question about how we assess what arbitrariness is when it comes to issues of freedom, and that, you know, is a question that's bigger than a 15-minute presentation. But it seems to me, you know, at least in the United Kingdom, the lack of parliamentary scrutiny is sort of a huge amount of alarm. And I think this has been, or should cause a huge amount of alarm. And there's been a move towards executive measures in many countries. The idea that democracy somehow gets in the way or stops an effective response. And I'm quite skeptical of that. I think that that is really easy rhetoric for people with authoritarian tendencies to use. And one of the things that I was struck listening to the other presentations was a common theme that the pandemic affects people who lack power in a lot of ways, right? Whether we're talking about people who are in prison, whether we're talking about people subjected to domestic violence, people who are homeless, These are people who are on the fringes of society, and they are very much, in my mind, sort of the canaries in the coal mine when we think about liberty and equality. And people are, sort of can easily dismiss how, say, COVID regulations affect the homeless. But this, if you take sort of a Republican conception of liberty, where you can see that there is a codependence between sort of individual freedoms, if one domino falls, it's a matter of time before the other ones do. And I was really fascinated to see this sort of developing independently in the analyses in a lot of ways. So yeah, I mean, thank you to everyone for their presentations today. They were extraordinary.
Well, right back at you, David. It was fantastic, and I agree. Fantastic presentations, fantastic commentaries. Adrienne and I are overjoyed. I will open for questions. I'm very aware that we're close to the end of the time we had planned. Whoever wants to stay is welcome to stay. Whoever has commitments can go. But whoever wants to ask a question can easily do it, just opening their mics and cameras, or just the mics. At this point, I will be less harsh on time.
I have a question for Jen and Marie, if it is possible,
Yes.
about the theoretical basic for your paper, because you hardly talked about the theoretical dimension. And it seems to me that you use the classic approach to public health. And I think that you might find interesting theories of relational public health ethics, which really concerns the idea that public health ethics should be should not only the contradiction between public health and individual rights. It also should recognize that individuals are not isolated islands, and that each policy may affect differently different groups inside a society, and that certain public health ethics may deprive certain alternatives from certain groups. For example, the idea that in a curfew that you cannot stay outside, it has, as you said, different effect on homeless people and on people that do have homes. So I do think that you might find it interesting to look into relational theories of public health, which is maybe less classic approach, but and I can send you a paper which I wrote and already been published about using relational ethics during the corona pandemic, and the idea of location and all the measures that were used during the pandemic. So I will be glad to send it to you.
Thank you. Sabrina, est-ce qu'on a le temps de répondre?
It was more
I'm sorry,
a comment than a question.
Yes, please.
Answered in French, but
yes, please.
Yeah, no, that's very interesting. Yeah, we would be pleased if you could send us your article. And it's, as Jean-Frédéric said at the beginning of the presentation, it's also exploratory for us because we're all members of this relatively new research center on governance law. And I think it's a very good occasion for us, this book, to deepen our research and thinking on the theoretical framework. So if we can bonify it with your article, that would be really great. So yeah, thank you.
Any other questions? As Adrienne mentioned, feel free to either pop them in the chat or raise hands. Thank you very much, Octavio. It was really nice to have you with us today. Thank you for your comments as well. Yes, Marie-Ève?
Yes, I had a question for Nili. It's just, and I thought it was very interesting to see how you researched through the parliamentary discussions. And I think if I remember well, there was one slide where it was like, okay, discourse about public health protection, and then another slide more on human rights. And I was just curious to know if at some point both were linked together, that someone would say it's through the protection of individual rights that we will make some gains on protecting public health. Because in public health, we have sometimes there's a tendency to oppose collective interest and human rights, but there's also another perspective that it's by fostering individual rights that you actually accomplish public health gains. So was this present in the parliamentary? I can't hear you. I don't know if
I think that it depends who was the speaker, who presented the things. There were those who really stressed the issue of public health. We should do anything to stop the pandemic. There were those who gave more weight to the idea of human rights. But in the end, it was acceptable to everyone that the parliament should strive for a balance between public health and human rights. The question was, where does the right balance is? This was the question. And there were some that believed that you can give the Israeli Security Authority the authority to trace cellular phones. They really thought that it stand the required balance. So I think that there is something to do with the political view. How liberal are you, or whether you want to, you look only into the danger to public health. So I gave only 2 citations because I couldn't obviously bring them all.
Thank you so much. Adrienne, you had your hand raised.
Yes. Thank you, everybody. Very, very happy to hear how everything's going, and really delighted to have all the discussants as well. I thought I would maybe take the opportunity to ask David a couple of questions as the non-lawyer, I think one of the few in the room, and perhaps to explain a couple of things that maybe I would like to hear a bit more about. So the first thing was that you said that there was perhaps a tendency towards a personalized government. I wonder if you could just maybe explain a little bit more what you mean about that. Just as for the non-politics theory people like myself, and also something about keeping bad company with the libertarians. I wondered if you could explain a bit about that, because again, I think perhaps these are the things that I just kind of missed, and perhaps if other people are not so well versed, they might have questions about that too. But thank you so much to all, and especially to our discussants and everybody for joining. Well, we're really thrilled to have you all here.
Sure. Yeah, so personalized government, it's, I don't know, maybe it's an idiosyncratic term to myself, but I use it to describe forms of governance that are not constrained by external or democratic accountability, right? So it's frequently used in the history of Republican thought in reference to sort of monarchic government. If you read people like James Harrington, people who were writing around the Civil War period in Great Britain, they often refer to the king as having personal government or having a personal veto over the decisions of parliament. And this for them was the sign that we were living in an unfree society. If the king is in a position by which simply by an act of will, he can disallow any form of legislation, then we're living in a personalized government. I say Johnson has this tendency because he hates parliamentary accountability. He doesn't like the civil service. He likes to surround himself with special advisors. And it creates this sort of, well, personal rule in a very significant way. Now, it is constrained in some ways, certainly by the Supreme Court, that sort of knocked back his attempt at proroguing Parliament. But of course, this government is in the process of finding ways to diminish the power of the Supreme Court is a direct result of the sort of interference, which of course they are able to do because the way that the British Constitution is, I don't need to tell people this, it is Parliament, right? Parliament, if Parliament decides that the sun revolves around the earth, then they can pass an act and we have to recognize it in a certain way. So that's what I mean by personalized government. Bad company is, you can see it if you look at the people who are bringing up freedom and liberty in relation to the COVID-19 pandemic. And I say this in all seriousness, it links into like hardcore conspiracy theorists, right? People who are convinced that there are 5G signals trying to limit family sizes across the world because Bill Gates is trying to control the global population. These are the people who often fall back on on freedom as their rallying point. And there's some interesting work done on this that says, they can do this because freedom, unlike concepts like fairness or equality, is an easy concept to understand. Now, I personally don't think that that's true. I think that this is a symptom of the right's dominance, or a certain element of the right's dominance over freedom as a political concept. In fact, freedom is an amazingly complicated idea. But when I talk about the libertarian objection, it runs with bad company because it's in the company of the lunatic fringe. But I think, as I sort of said in my presentation, just because it has bad friends doesn't mean it's necessarily as implausible as conspiracy thought. And yeah, that's sort of, hope that answers the questions.
Thank you, that really does.
Right.
Thank you so much. Any further questions? Any thoughts? I don't see hands raised, so I guess we'll, oh, Marie-Andrée, sorry.
No, I just want to say thank you, David, because this tangling of, they don't have to be bedfellows always. So I think that was really refreshing, so nice to see that, yeah, these things can be argued in a reasonable way, not necessarily with the usual allies that make it, yeah, those associations that means that sometimes we forget the substantive claim, which could be valid. Thank you so much.
Fantastic. So on that note, if there are no further comments or questions, I will draw this day to a close. I want to thank all our participants and our discussants as well, and everybody coming to listen to this work in progress symposium. We hope you can join us tomorrow as well. It was an absolute pleasure to have you all. I want to give a special thank you, of course, to Sahar for all her help with the organization. And please keep in touch. And if you have any further questions for our participants and contributors, please feel free to ask us to transmit those questions to them or to email them directly. Thank you very much.
Thank you all. We hope you join tomorrow at 10:30. You can use the same link